it's a case of that my major concerns around it is that I fully appreciate what Mark's saying, and in fact, I'll use some of what Mark's saying later on in my comments. The modelling is till 2024, yeah, and I don't see why we can't extend that modelling to 2035 when we've got some pretty baseline data on population growth. That's been produced for the local plan. Now, clearly, yeah, just because you don't know anything doesn't mean you know nothing. And so we've got a plan on planned population growth for Leicestershire and Rutland. Why are we running it to 2024? Because the danger is, and my worry is that £450 million investment does not come your way every year. It does not come your way every 5 years. It comes your way about every 20 to 30 years. And the problem is, I would be looking to at least model this till 2035 based on population projections and see if it's okay till then. Do we know whether a COVID-19 or similar epidemic's going to hit? No, we don't. But do we have a good idea what our current population to needs ratio is now? And can we extrapolate that? And can we extrapolate it beyond 2024? The other issue is again, I absolutely agree with Mark about services being out in the community. But we heard from Councillor Iron, we didn't have any information on what's happening to the hydrotherapy pools. It's still not being able to be produced. Yeah, something like, where will a hydrotherapy pool be? And we have this again and again, when the idea is that we will have treatment in the community, which I absolutely agree with, yeah. But where's the plan for that treatment in the community? And as Councillor March has alluded to, by the time the timelines all seem a little bit skew-whiff to me. And probably one of the biggest areas of concern is, if we're going to get this stuff out into the community, where is the community plan? So far as we've got it, we can't even answer a question about hydrotherapy pools as we sit here today. And the final thing, and whilst I'm on, so I don't keep bobbing in and out, is, again, Mark says the future is uncertain. The future is always uncertain, which is why I have a particular issue with the proposal to sell land at Leicester General Hospital. Because whilst we have flexibility around everything else, once that land's sold and is in the hands of Barrett's or Jelsons, or William Davis, yeah, it's gone. Yeah, our flexibility on that site, and I know what Mark's going to say about Glenfield, but our flexibility on that site goes. Yeah, and we've got to remember that is a general hospital site that is currently being used and could be purposed for a vaccination centre for the county. Yeah. So again, nothing stunningly original in what I've had to say. The concerns are still the concerns, but I absolutely make them as concerns, and I feed them back as comments into the consultation as a member of this committee, because some of it is stuff that's been expressed to me, but some of this is stuff for myself. I'm not medically qualified, but when I see a number that doesn't quite add up, I know my numbers, and that's what I'm asking about. And so I do that in that context. Thank you very much, Chair.
Thanks, Patrick. Thanks very much. Mark, do you want to come back, or you're okay with that?
I think we just note the comments, Chair, in that I've given answers previously.
Sure.
I can't make them any better or any different.
Quite.
Thanks.
No, I mean,
I might comment, Chair. I think I really appreciate the answers I've had, and I'm sorry if I seemed a little intemperate earlier. I think the point that I'm trying to get is, I think we all share a common purpose here about trying to make these the best proposals that we can, and I absolutely accept the scrutiny process is part of that. There are some areas, and this is one, I think, where our role here today is to kind of listen and not just to kind of answer or relay. So, if there's a very clear view here that we need to hear about, why can't we extend the planning period forward a bit? What about clarity on some of these other things? That is for us to feed back and to take on board. So I think we are listening as well as responding. And I guess in this instance, I think the correct thing to do is for me to note those comments, and we'll take that into account when we kind of consider the overall position at the end of the consultation and try and agree what happens next. So apologies if we seemed, or certainly if I seemed defensive. That wasn't my intention. We are listening and trying, I think, to take on board the comments received. Thank you.
Thanks very much, Andy. No, that point's made. The only other thing I've really got on my list that haven't really been covered at all, I don't think, or no, a little bit, I suppose, from Janet, is car parking in the new facilities, transport, how to get there. A lot of people have said to me, particularly, and we've mentioned it, Sarah Hill's mentioned it, Rosie Page mentioned it, where we are out in the sticks, it certainly applies to people in Rutland and Melton. We're a long way out, and rural bus services are rubbish to all intents and purposes, especially after hours. I mean, 6:30 at night, you can't get to my village from anywhere. The place just shuts down in terms of buses. And if people can't drive, they have no one to take them. Other than hiring a taxi, a lot of these people, there is no obvious way of getting to and from hospital appointments or seeing your relatives if you want to go and visit them. Has anything been, I mean, I heard something about the fact that certainly the Glenfield car parking was going to be extended, and I hadn't heard what was going to happen at the Royal. Anybody able to fill us in on that? Aha.
Justin's coming in for us.
Is that?
I have to apologise at funny camera angle. It's because I'm actually sitting in my car in Leicester because the village is just at our phone lines cut off halfway through Hosk. So I'm sat outside Building Palmer Community Hospital using their Wi-Fi. So I do apologise for the odd angle. Yeah, transport. So we've done a lot of work over the last few months with working with a company called Go Travel Solutions, who are a sustainable travel company working across Leicester, Leicestershire and Rutland. They've taken our travel action plan, or travel plan, which is the technical document on the website, and turned that into a travel action plan. They've set up a travel forum and engaged the city and the county, as well as Health Watch and others, but particularly working with the travel companies, the bus companies, to then look at all the options that we get. So if we just take parking, car parking, we, in our plans, we're proposing to extend car parking at both the Glenfield and at the Royal site. But what's interesting is when we've done our numbers in terms of footfall for the two sites, there's a reduction to the Leicester Royal site of approximately 30%, going up to 40%. And for the Glenfield, that increases. So because we're moving the outpatient and day case side over to Glenfield, it changes the impact. So it actually reduces the footfall and therefore hopefully reduces the traffic flow over to the Royal. The other big pieces of work that then we're doing on travel, working with Go Travel, is around park and rides. So councillors, both for the city and the county, will know the extensive work that's being done with park and ride at the moment. That's including the expansion to Beaumont Leys, and then looking at other park and ride services around the peripheral of the city. Doing really good work with the City Council around electrifying the bus routes and reviewing the hopper routes. So really thinking about the broadest sense of how we can get patients to the hospitals without them needing to use their cars. And then another one, which was quite interesting, is the Santander bike. So this is the electric bike investment that's coming into the city. On the car parking side as well for the Royal, we're just changing the barrier. So any of you that have been there in the last year will have seen that periodically we have really bad traffic sitting on Havelock Street. And that's because it isn't utilising registration number technology. So we're flipping over to that shortly. So that will, again, reduce the perception that we don't have enough parking. But the bigger thing that we're doing on both sites is with the architects. So we've appointed our major architects, and they then do a whole site plan, which looks at how do patients move around the sites, how does traffic move around the sites, and where do we best need buses and cars coming in and out, so as it really improves flow and makes things far better. Obviously, we have to do this within the purse that we've got, and we will never fix the rural issues in the way that we'd like to. And again, your councillors representing many areas. I saw Rosetta on here, who represents Lutterworth. I live in a village that has no bus route, and I have to drive 5 miles to get to Lutterworth before I can get a bus. So I genuinely understand and personally understand some of the challenges that some residents have in terms of getting there. And this is why we're using specialist companies to work with yourselves to really think about the best ways that we can improve things. And the last thing I'd like to say is that this plan takes us beyond consultation. So we engaged at the beginning in September. It will take us way beyond consultation, because as we roll out the plans post-consultation, we'll need to be working in a co-produced way with patients and the public to make sure that we improve travel wherever we can. Thank you.
Thanks very much, Justin. Thanks very much. That's very helpful. Gail Waller.
Thank you, Chairman. I appreciate what Justin has just said, particularly his own personal understanding of living in a rural area. But I do have a couple of questions. One is, does the company Go Travel understand what it's like living in a rural area? In Rutland, we have no buses without subsidy from the county council, and we know that our budgets are going to be stretched going forward, or all of our budgets. So clearly, the subsidy we give to the bus companies will have to be reviewed along with everything else. So I'm not implying that we're going to cut them. I'm just saying, you know, it's out there for us. And even where we have buses, they don't necessarily go to Leicester or anywhere near Leicester, where you could pick up one of these wonderful hoppers that are being planned. So for those of us who live out on the eastern side, and I have to note that when you were talking, Justin, you didn't mention Rutland at all. You talked about the county and the city. Those of us who do live this side, it is private car, quite often a neighbour's private car, because we are beyond being able to drive ourselves because of our age and infirmities. And if you are putting on other people to help you out, the one thing you need to know is that that person isn't then going to be driving round and round and round for hours looking for somewhere to park. So car parking is an absolute essential. And if it's a park and ride scheme, and I'm all in favour of those, then the actual parking bit of the park and ride has to be convenient to the people who are doing the driving, which means on this side from where I sit, the eastern side of Leicester, before you, well, somewhere on the A47, I would guess, would be the right place to put it. And I can't think of any convenient sites to make into a park and ride over there. And I have to say, when I worked, I did drive into Leicester pretty regularly. So I'm sort of fairly familiar with the A47 and what's on it. So I am unhappy about the response you've given. Having said that, I fully recognise it may be an unsolvable problem. And if that is the case, if it is the case that we are going to have to just make do amend, then please say it up front. Please acknowledge that there are going to be ongoing problems. And whilst we've looked at A, B and C, we can't find a solution, because people are happier knowing that they've been thought about, but there's no way around it, than being given empty promises about park and rides and what have yous and the electric routes and all the rest of it. So my plea really is for a bit of honesty about how some people are going to suffer if we have to travel to, you know, LRI rather than the general, for example. Thank you.
Councillor Feltman, can I come back on that, please?
Do, please, Justin.
Councillor Waller, I sincerely apologise. I should have said that Go Travel Solutions have done 2 specific sessions with Health Watch Rutland in Rutland to talk to Rutland residents about Rutland issues around transport. We've also got Rutland officers, highway officers, on the steering group to make sure that we cover off the issues for Rutland specifically. Absolutely, we recognise that there is only so much that UHL can do, because actually highways sits within the council's responsibility, not ours. So what we're trying to do is do as much as we can to make sure that we've invested in car parking, and we're working with the councillors for both Rutland, City and County to make sure that any of our problems, our challenges are shared with yourselves, so as we can all come up with the best options that we can, with the understanding that ultimately we will only go so far and we won't be able to completely fix the rural transport issues that we all face. So I apologise if I didn't stress enough how much work has gone in with Rutland specifically.
Yeah, thanks, Justin.
Thank you for that.
Yeah, thanks, Justin. Paul Wesley. Sorry. He's clicking.
Mute.
There you go. You're away.
Can you hear me?
Yep.
Oh, fine. Thank you, Justin, for that. I represent, obviously, the Glenfield Hospital ward, where we're going to start extending more car parking. Does this bus company that's taking over, or you're giving a contract to, what's their climate change policy? Because a lot of my constituents are becoming more concerned on the climate issue with more car parking in the ward. And also, over the years, 26 years I've represented that ward, the bus service is not very good. And I feel sorry for my colleagues in the county whose bus services finish at 6. And I'm sure that needs to be addressed as well, to make things easier for people to travel when they need, especially to the hospitals. But climate change is so important, and especially the pollution around the Glenfield Hospital. Thank you, Chair. I've been very patient and listened to everybody, and I think they've all made some very common sense opinions.
Thanks. Any comments, Justin? I mean, it's
Yes, certainly. Councillor Wesley, we're not personally awarding contracts to buses. We're doing it with the City Council. So it's yourselves that are actually awarding the contracts and doing all that side. We're just working with you to make sure that the needs have all tied up together, really. So, and Go Travel Solutions are a very green, sustainable travel company who are looking at every alternative to car parking, but we just have to get the balance right. So absolutely, we're completely committed to making sure that we maximise the green opportunity. Hence why the City Council are rolling out the electrification of the bus routes to try and improve the pollution around all sites. So it's actually in your gift, Councillor Wesley, rather than in ours. So yeah, it's good. It will be positive.
Thanks, Justin. Just to let everyone know, I'm closing the questions bit. We have 3 other papers to scrutinise today, and I think we've gone through this enough. So, Janet Underwood.
Chair, I did ask a very quick question that I put it in the sidebar, but nobody's picked it up.
Right.
In one of the answers, they said that the new buildings will be designed to environmental excellence, but will it be built to that standard? Because design and building are 2 very separate processes, as I'm sure you're aware.
Yeah, I know. Justin, have you got enough to know about that?
I do, yes. So the answer is yes. For the new builds, they will all be built to BREEAM Excellent.
Yeah, there you go.
Thank you, Chair.
Thank you. Janet, sorry.
Yes, thank you, Chair. Just for the record, we've had one Rutland specific meeting with Go Travel and Justin and his team. The rest of the meetings that have occurred, Healthwatch Rutland has been invited to and has attended. I've been trying all the way along to think of ways around dealing with the rural issue, because yes, it's there, but we can't actually get to UHL by magic carpet, and we can't move all of our homes into the city centre. So one of the things that I think I would ask UHL and the CCG and everybody else to consider is whether it might be easier if the hospitals could introduce a patient booking system, i.e. just as we can book online for a doctor's appointment, or we used to pre-COVID, could patients not book their own hospital outpatient appointments That way, they can choose a time that fits in with public transport or with the availability of a private car, rather than the hospitals actually just send a letter and say your appointment is on this day, you will attend then at this time. It just seems to me a bit of a no-brainer that the technology surely must be there for that to happen.
Yeah, having worked in IT in the health service for the last 50 years of my life, I have to have a little chuckle at that. Yes, the technology is there, you're quite right, but gosh, whether it ever gets put into place. Any ideas on that, Justin? How we get it also would be the patients.
I think I'm the best person to answer the question, to be honest with you. But obviously we're looking for a major digital rollout, but Mark's got his hand up, I'm sure he's got an answer.
Yeah, Mark will do this one.
Mark's there. Go on then, Mark.
Well, don't for any stretch of the imagination think I'm a technical expert. I defer to you on that, Chair. But it is certainly our intention that the current outpatient process, as an example, and bearing in mind we see 1.1 million outpatients a year, needs revolutionising essentially. And I guess the two main elements of it are, one, we should only be doing outpatient procedures in hospital that absolutely need a face-to-face appointment. The rest should be exported to community settings or done virtually. If people do need to come into hospital, then the booking system, as Janet describes, I think is, well, I know is something we're working on in terms of how the treatment centre works, so that it is done. It can never be entirely at the patient's convenience, but I think the patient's convenience has to be taken more into account than it is at the moment. So that would involve, as an example, not just working kind of, you know, I'm simplifying to make the point, but not just working 9 to 5, Monday to Friday, but 6-day working, longer day working for our clinicians. So they work from 8 till 8, which gives people more options in terms of when their clinic slots will be, if they do need a face-to-face appointment. And all of that will require some IT underpinnings.
It will indeed. And finally, on this aspect, Gail Waller.
Thank you very much, Chairman. My question is slightly different in that we've talked about having provision in the community, and I'd like to hear, I guess, from Andy, is there physical capacity? I'm not talking about the medical, I mean the buildings, physical capacity in our communities to actually make the provisions that we're talking about.
Thank you. Shall I come in on that, Chair? And
yes, please do, yeah.
Just talk a bit about how that's going to work. Would that be helpful?
Yeah.
Not sure if you can hear me. Can you hear me?
Yeah, I can hear you, yeah.
Can you hear me? Yeah. So
Going in and out. Yeah. It looks like your connection is not viable.
Andy appears to have frozen, Chairman.
Frozen.
I'm happy to have a written answer appended to the minutes.
Yeah, fine.
Possibly pass to Sarah Prima if Sarah's still on. If you're struggling to hear me.
I can pick it up if you want me to.
Yeah.
Go for it, Sarah. Thank you.
Okay.
We can. I suspect we'll have quite a few written answers to questions.
I'll just do a brief overview, and then we can provide some more written responses. So So what I'd say is that community services is a developing piece of work, and it's been developing for a number of years. It doesn't stand still. Some of you will be familiar with the Better Care Fund. That's been a programme between the local authorities and the health service for a number of years, which is all about integrating care at place level. And most recently, we've had the Ageing Well programme that has supported integration at place and locality level. So that work continues, and it will continue over the next few years. So I think the development of community services is an ongoing process. There are lots of changes that come with medical advances, etc. And I think we've touched on some of those when we've had a discussion earlier. So what that means is that we are going to continue to develop our community services offer through what we are calling our design groups at the moment. So we've got a design group that is specifically looking at primary care and community services at place and locality level. So place for us is the county, Rutland and city, and the locality level are smaller units underneath those, predominantly around primary care networks. And they will take forward that integration between health and social care. Alongside that, we're embarking on developing locality or neighbourhood type plans where we need to do those. So we've been talking to Rutland and Melton, for example, and Lutterworth around developing place-based plans. They're the early ones we're doing because we've got some issues around housing growth in those particular areas that we need to address. So in terms of community services development, it's a two-pronged approach. It's through design groups and developing our services. And, you know, that isn't starting from scratch. As I've already said, we've got lots of plans that are already in fruition around those sorts of things that have come out of the Better Care Together programme and the Ageing Well programme, and then developing more local plans to address wider issues than just communities and primary care services, such as local elective care services, etc.
Can I come back on that, please, Chairman? Chairman, you're on mute.
So I am. Sorry.
May
sorry.
I come back on that, please? Oh. Thank you. A lot of the services that were being talked about, particularly the integration of health and social care, of course, we as county councillors are very aware of, and actually, in the most part, fully supportive of as well, because we can see the positive impact it's having on our residents. But certainly within Rutland, and I do not think we are unique, we are also aware that our residents are increasingly finding it difficult to get doctors' appointments. And it's not because there aren't the doctors, it's because there aren't the consulting rooms, the actual physical space. Yeah. And if we're going to be putting more into the community, I just noticed our chairman frowned slightly. It's an issue of increasing population on the one hand, and Rutland, in our case, Rutland residents opting to come back into Rutland for their GP services rather than going outside to Stamford, which is all quite understandable. It's the physical space I'm asking for. And is there money being put aside to invest in new or different, either new or serious reconfiguration to make existing buildings more flexible and useful?
So that's the sort of work that we'll pick up through the place-based plans on the back of housing growth in areas.
Yeah, quite. Now, the reason I frowned, I've just had a brand new medical centre built in my village, which has got so many consulting rooms, but not enough staff to keep it going. So we still have problems getting appointments. It's obviously, it works both ways, doesn't it? We've obviously had we have had effectively about 3 hours now on this reconfiguration, and I think we've done our bit in terms of scrutinising. Maybe not as far as we'd like to go, and some of the questions perhaps didn't get fully answered, but certainly it didn't help, obviously, the fact we had a break in the middle when YouTube across the whole of Europe failed. I hope it wasn't us that made it fail. Just to let you know, 2 of the papers that we've got left on our agenda, one about the impact of COVID on dental services, and the other about the East Midlands Ambulance Service. Sadly, both of those people presenting those have had to go. We can't have them today, I'm afraid. We'll obviously reschedule, have another day. So the one item we have left on the reports is from Caroline Trethithick on the vaccines, how it's working, I suppose, and how it's going to be laid out across Leicester, Leicestershire and Rutland. Caroline, are you around?
I am, Councillor Feltman.
You are?
Yes. I've been listening to the debate and discussion, so thank you for still allowing me to have a conversation with councillors. And apologies, this is a verbal presentation. As you can imagine, the programme is moving pretty quickly, and I knew that if I wrote anything down, you could guarantee that it would have changed. So I think what I'd like to say is that we're absolutely thrilled that vaccinations have started in Leicestershire. So we started out of the Leicester General Hospital on Saturday, and we've been vaccinating Saturday, Sunday. We've got more people booked in today, and our plan is to increase the numbers of people coming through the hospital hub as much as the site will allow, because obviously we've got to ensure that we maintain infection prevention and control precautions on the site. In terms of the programme, from a national perspective and a local perspective, I think it's fair to say it's a challenging programme. We've learnt so much about the Pfizer vaccine over the last 3 weeks, and as a result of that, are responding to some of the safety issues that are coming out of it, particularly around storage, transportation, observation of patients post-vaccine, and those sorts of things. And I suppose in line with the national process, we've got our initial focus starting with the hospital hub, and we'd originally hoped to put a vaccination centre in place, but as the logistics of the vaccine kind of played out, it soon became clear that we needed to put a hospital hub in place before we could set up a vaccination centre. We're also focusing on primary care delivered vaccines, and we will be rolling those out later this week in the next few days. And so people will be able to go to vaccination places within their local areas as we start to see that steady rollout over the next few weeks. I think we're being fairly consistent with our message that if people are anxious that they haven't heard anything about it, the message to the general public is please wait and you'll be called for vaccine. We've got to manage our stocks of vaccine really, really carefully, and we've got a national approach to risk stratifying the population in terms of over 80s at the moment, and care home staff who are caring for our most vulnerable, and then our at-risk staff who are also caring for our most vulnerable people. So that's where our focus is at the moment, but we've got vaccines on sites. We are making sure that if we haven't got enough people in those categories, then we will be drawing other people in, because the last thing that we want to do is waste vaccine. But a really kind of momentous time for Leicester on Saturday, and I think the staff who've been involved in setting up the whole of the programme were really excited and pleased that we finally got vaccines in LLR, and it sees the start of our programme. In terms, I will obviously pause for questions, but I do need to caveat with in terms of what I'm able to respond, because the programme is moving so quickly, there may be some things that are still being thought through nationally that I'm not able to give a local response to, but I will absolutely do my best to respond to councillors' queries. So if I pause there for questions.
That's lovely. Thank you very much, Caroline. Jonathan, you've got your hand up.
Thank you very much, Chair, and thank you very much, Caroline, as well for that. On the point about communications, I appreciate it's very difficult at the moment because there's a huge amount of expectation, and delivery is very much set at the pace of delivery of the vaccines themselves, and obviously, that isn't ideal. Is there any way that a schedule can be published or something can communicate to actually demonstrate where the likely vaccine stations are going to be coming on stream, what dates, and also which GP surgeries are actually offering vaccinations, or which GP surgeries are actually clubbing together to actually use bases other than their own? It's just that I know comments have been made to me questioning about where are they going to be as far as the GP surgeries particularly are concerned, and quite a few GP practices are putting up pretty nondescript notices on their website saying don't contact us, but we'll contact you. And I think it's just providing a bit more information
Yeah.
to enable people to have reassurance that there is a particularly wide network. At the moment, obviously, the press publicity has been around single instances in single locations, and that's received a huge amount of positive publicity. But the question is then, well, what happens next? Because that's happening in Leicester, but I don't live in Leicester. I live in Loughborough. Or I live in Market Harborough. You know, where am I going to go now? I know in Loughborough we're converting a bit of the council building in the middle of Loughborough for a vaccine centre, and hopefully that'll be on stream before the end of the month. But yeah, there are going to be dozens, if not hundreds, of additional stations all around the county and city. And I guess people probably want reassurance that that network is there and it's going to be coming on stream over a period of dates. And I was just wondering, what can you actually do to actually give that confidence?
So the only confidence I can give you is that we have got that plan in place. I think in terms of being able to announce it, we're being supported on a national basis with our comms, because we want the national, we're a national NHS, of course, and they want to be able to make sure that we're not publicising anything if it doesn't happen, because so if I give you the example, over the weekend we've been working really closely with some of our practices that are going to come online this week, but because we've got changes in terms of what we know about the vaccine, we've had to do some alterations to the locations. So that kind of on the spot movement can therefore completely scupper whatever comms plan we've put out in place. We do intend that as soon as we get the go-ahead, we will be publishing what we can, because I absolutely agree with you, Councillor Morgan. This is the information that we want to get out to our public to give them that reassurance. But whilst we're going through this really early part of the programme, I can absolutely understand why NHS England are just trying to kind of take us a step at a time, not raising public expectation, and just in case it doesn't quite go ahead. So if we've arranged to set up one place and it doesn't go ahead and we do something else, people will think actually they're all over the place. So it might feel like it's a slow drip feed, but actually it's a carefully managed in terms of where we've got absolute confidence that a practice is coming online today, tomorrow. We can do that formal public communications, but absolutely rest assured we have a comms plan ready to go as soon as that we're able to do this, and we need everybody's supporting to be able to advertise that. There is another security-based issue, if I'm honest, though, that I know that will be giving people some concerns. We've already heard that there's been fights breaking out across the country where we have got vaccination places set up. So we're working really closely with our police colleagues to make sure that we're not putting any of our clinical settings at risk. And if we were to publish things, that at the moment it's a bit sensitive at the moment. So please bear with us. I know it's not what you want me to say, but we're trying to do the best for getting the programme rolled out from a clinical perspective, so it's safe and the population is safe.
Yeah, thanks, Caroline. Amanda Hack.
Thank you, Caroline. I just wanted to start to put across our thanks on behalf of councillors that this facility has been set up so quickly, having had the racecourse as your first piece of work, having to go over to the hospital at the General. We appreciate just how much effort colleagues in the NHS will have gone to get that in place. So thank you. I think obviously the key things that come across to me as a local councillor is, you know, when can I get vaccinated? I don't want to be vaccinated. And I think there is this real conflict between those that really want to get going on the vaccinations and those parts of the communities that just feel very unhappy about being vaccinated at the moment. And I was just really interested about the publicity that we might do locally to encourage as many people as possible to get vaccinated. And the sort of second question really is, because the vaccine is a double dose vaccine with a delay in between, is just to sort of think through just share with us the complexities that gives you in NHS in terms of managing that two-phase, and what you expect the drop-off to be, in a sense that somebody comes for the first vaccine and then doesn't come forward for their second. Thank you.
Okay, thank you. So just in response to your first question, at the moment we're almost contacting people individually to where we know we've got vaccine available. So talking to them individually about, actually probably first and second question, about appetite to come in for the vaccine and appetite to come back for the vaccine. So we're trying to focus our offer at the moment, because bear in mind, we've still got really limited supplies. We're not awash with vaccines across the country. So we're trying to make sure that we use it appropriately. So approaching staff and over 80s at the moment that we know will come back is a really important part. The other important part of our comms campaign going forward is that when we start moving into the wider categories of people who are going to be vaccinated, we're going to want to work with people to get champions in our local communities to try and encourage them. We've learnt a lot from the testing that we did through COVID, the flu vaccination programme, about in-reach into communities and using local leaders to support that programme. Again, part of our comms campaign, at the point that we can press the go live button on that, we'll be coming back to you to say how this is what our plans are, how might you be able to support us to do that. And I think, you know, that's where people do need to be upfront and say, I'm prepared to have this, look, it's okay, and we'll get some comms around those local champions going out into their communities.
Thanks, Caroline. Mukesh.
Good afternoon, everybody. My question to Caroline is, what plans do you have for rough sleepers and the homeless with regard to vaccinations?
Yeah, so we've got particularly interesting parts of our community to make sure that it's a full programme and that we're not just approaching it from an opportunistic perspective, you know, just being able to vaccinate those people that want. So we'll be working with our partner colleagues in local authorities and in primary care to ensure that we can do that in reach into those populations as well. I think the rough sleepers, the homeless, our prison populations, those sorts of things, you know, we've definitely got to do this differently. And we've been working probably for 6 to 8 weeks now with local authority colleagues on how we might do this to do that in reach. So they won't be forgotten about. At the moment, they're not on that national list of priorities, which I know from conversations with Councillor Kittrick last week about our flu programme, they probably ought to be. So we need to be looking at what point can we start to flip the programme from the over 80s into some of those categories where we know we've got some very, very high risk people.
Yeah, thanks, Caroline. Ted.
Oh,
got it.
Hold on, there we go. Right, so Caroline, again, uncertain at the moment, but given that we anticipate the Oxford vaccine to be given authorisation for use, is it intended that it will be used in addition at the same sites, or are you looking to roll that out in other places, or are you looking to use the BioNTech first and then start you? I mean, what's the thinking? Because obviously that will massively boost numbers.
It will, yes. So we know we've got a particular problem with the Pfizer vaccine not being you have to bring people to the vaccination point rather than the vaccine to the person. So the AstraZeneca vaccine, when that gets authorised, will massively ramp up, particularly care home vaccinations, housebound vaccinations, those sorts of things. We do have a piece of work to do with our clinicians to understand what the makeup is of the AstraZeneca vaccine, in that it might be different from the other one. I'm not sure from a clinical governance perspective whether it'd be safe to have both vaccines on one site, but we haven't seen the details about the new vaccine yet to be able to come to those conclusions. We will definitely be pushing it to that outreach first into those care homes where we can do it. I think the AstraZeneca vaccine will present so much more flexibility for us in terms of vaccination, and we will need to be working with the national team in terms of how much of each we will get. Those kind of questions are unknown yet.
Thanks, Ted. Melissa.
And thank you, Chair, and thank you, Caroline. Last time we spoke, we were talking about flu vaccines, and I was particularly concerned about kind of people who were formerly clinically extremely vulnerable. And I guess many of the people that I think of when I think about that in my mind will be the over 80s who are at home, possibly receiving some sort of domiciliary care kind of thing. I assume that they are now, as you say, they have to go to the vaccine. There's a real challenge in the frailty of some of them and the reticence they might feel, not around having the vaccine, but leaving their house to get it. I guess my question is, have we learned anything from the flu vaccination programme rollout that can help us to kind of reach those people and target them? Or what are we going to put in place to do that? Or is it just a case of waiting for the AstraZeneca one? Thank you.
Yeah, I think as a clinician, I would say that the best way to support those is to vaccinate their carers, their domiciliary carers, and they can get into vaccination centres. So the offer that's gone out to through the local authority ADASs is to try and access those people. So we want to be able to vaccinate as many carers, whether they be domiciliary carers, people who are doing the caring in care homes, or district nurses, whatever, the people that are going to be in those people's homes, because quite frankly, the safest place for those vulnerable over 80s that can't move at the moment is at home. So let's vaccinate the people who are going to be working around them until we can get to a position whereby we can take the vaccine into the person's home. So they're the thought process that we're going through to try and bring as many staff in as possible. So it's not saying that we're not worried about those over 80s that are in home. We are worried about them, but there's a better way of putting a wraparound support around them.
Thank you.
Yeah, thanks very much. Patrick.
Just a quick question. I'm curious, why did we think the racecourse was the best initial solution rather than the general hospital? Because I'd have probably guessed that if you'd had allergic reactions and other complications, I'd rather be next to a hospital than next to a set of stables.
So it's all to do with the planning assumptions that have changed over time, Councillor Kitterick. In terms of a focus on staff, being able to bring them onto a non-NHS site was absolutely the right thing to do. But as we then it then became clear that we wanted to focus on staff and patients, being able to have it on a hospital site where patients are attending an outpatient appointment made that much more of a better solution. It doesn't mean to say that the racecourse is off our plans. We're still progressing, but in terms of the start of the programme and where we want to focus our limited supply, we needed to set up the hospital hub for us to do it in the best way possible.
Yeah,
I absolutely agree. It was just an interesting initial choice.
Yeah, we had all over the local news around where I am as well, because it was it's closer to me. Rosita.
Thank you. I've got a very short question. Quick comment, getting it out there. In our rural areas, we have got a very good volunteer and community transport system. It's very effective. But my short question is, younger people with learning disabilities who are in the system, where do they fall in that priority? Because surely they've got to be quite important. So if you can talk me around that, please. And thank you for all the good work work you're doing.
Thank you, Councillor Page. Absolutely, the young people with learning disabilities are definitely a priority. And again, I kind of refer back to the fact that we're a national health service, so we're managing the rollout of the vaccine based on the national guidance that we've got. But they are on our list to come to before. So if there's a 16-year-old or a 20-year-old with a learning disability, they'll be ahead of the list before a 16 or 20-year-old that doesn't have a learning disability. So they will be rolled out. And we're currently trying to work with NHS England in thinking through our best attempts not to waste vaccine, and how we might bring some of those more vulnerable groups on quicker to support the rollout. And the last thing we want to do is not being able to get any staff, not being able to get any over 80s, and therefore we've got vaccine that's going to go to waste. That isn't the case at the moment. Please rest assured that we're nowhere near not having enough people coming forward, but we need to be able to move through those categories quite quickly as the programme rolls out over the next few weeks and months.
Yeah, thanks very much. Janet Underwood.
Thank you, Caroline, for your information. I just wondered if I could ask a little bit about how much you're using volunteers. I know that I belong to a large cohort of retired nurses, for example. I also read in the Times yesterday, the Sunday Times, that a retired GP was told that as a volunteer, he could do the car park management when he is, a doctor who is quite capable of being used better. So just wondering how you're managing volunteers. And I just want to say that in Rutland, we've had marvellous communication from our PCN, and they've passed that to Healthwatch Rutland, and we're disseminating it as well. So the info is getting out there, but in Rutland anyway, I don't know about elsewhere. But it's really the volunteers that the volunteer thing.
Thanks, Janet. So the Leicester Partnership Trust are managing our workforce bureau. So we've commissioned them to advertise for staff to what's called onboard them quickly, which is going through all of the recruitment processes, and ensure that we've got a bank of staff that are available to support wherever we've got vaccinations happening. Make sure that we've got enough staff to run the whole process. So that does go from car parks to marshallers, admin, and then all of the clinical stuff as well. We've got a range of job descriptions for these roles that are based on national job descriptions. So people coming in would need to be able to meet the job description role. So I'm not sure whether or not your example of your GP just isn't able to meet the criteria set to us by those job descriptions. And I know from your background, Janet, you'll understand the need to be able to meet the clinical criteria, particularly in terms of giving the vaccine. So they've been doing some advertising, and we've got hundreds of staff that have put themselves forward, which is really good. It won't be enough as we really start to ramp the programme up, so we are looking for volunteers coming forward. We're also working with the voluntary cell through the Local Resilience Forum to make sure that we can get access to volunteers that might want to come and support a local site in terms of setting up. So we've been, I think it's really pleasing that we're able to get those volunteers into the programme, but it isn't a case of just turning up and just because you used to be a clinician that you can do this. We've got to make sure that our population continues to be safe, yes, and so we've got those process checks in place that you would expect us to have for anybody delivering any kind of vaccination programme across the patch.
Thank you. Good luck.
Thanks, Janet.
Yes, quite. Thank you very much. Gail Waller.
Thank you, Chairman, and thank you, Caroline, for all the information you've given us, which is really helpful. My particular question relates to what happens next, that is when the Oxford vaccine's available and so on. When you're doing your communication, have you considered how you are going to communicate to those adults with learning disabilities who may not have a carer who would be directly looking after them, and also for those with other disabilities. And I'll give you an example. Despite my age, I have never, to my knowledge, been invited for a flu vaccine. Now, it may be because I can't read standard size print, a fact my GP surgery knows and chooses to ignore most of the time. And there will be others in my situation. There'll be those with hearing difficulties who don't answer the phone and those sorts of things. So has that been taken into account, please?
Thanks, Councillor Waller. I think your question absolutely describes the mammoth task that we've got ahead of us. To make sure that it's about 660,000 people across Leicester, Leicestershire and Rutland need to come for the vaccine, not once but twice. So our comms campaign, working through every single opportunity that we've got, needs to be right. We do know that there'll be a national call and recall process that will start at some point. And we need to think about how that will work as well. And that's kind of similar to for those of us that I do get a flu vaccine, and I did get a text that said, you need to come in for your flu vaccine. It's kind of automated normally. So we, as these systems are being thought through, we need to adapt our comms campaign to ensure that we make people aware of them, so that they don't just think it's a spam text or a spam email or whatever process they put in place, and that we've got mechanisms to do it. So I haven't got the detail to be able to share with you, but we're absolutely acknowledge that all of those problems that you've just described do happen, and our comms campaign has got to work with primary care and across all sorts of public sector agencies to make sure we're getting those messages to those vulnerable people who need to come forward. In actual fact, it's all people who need to come forward. The vulnerable are obviously our priority, but we need a whole population approach to this. And if we're not aiming with that 660,000 ambition in our sights, we're going to fail as a system in delivering what we need to do to resolve the problem that we're in. So that complexity of a comms campaign will absolutely factor in all those points.
Thank you. May I make a supplementary suggestion on that, please? We're being told quite clearly that we mustn't ask for a vaccine. We will be told when to come forward. And I perfectly understand why, perfectly legitimate response. But further down the line, when things are being going more widely, can we have a facility to contact and ask and tell people in their letters or whatever else it is they get, their texts, if you know somebody who should have it and isn't having it, this is the number they ring.
And that's definitely something they're working on nationally, like a national centre, so that there'll be a single point of that. So brilliant idea. We haven't seen the detail of that yet because we're not quite there yet. But yes, and as soon as we get anything, we'll publicise it.
OK, thank you.
Thanks, Caroline. And finally, sorry it's had to wait so long, Teresa Eldred.
Thank you. Thank you, Chair. Can you hear me?
Yep.
Just a couple of questions for Caroline. Thank you for all your amazing work that you're doing with the vaccine, by the way, and the hard work you've all put in. I've been getting, as a local ward councillor, people who are clinically vulnerable, extremely clinically vulnerable, but in their 30s, 40s, 50s. So don't fall into the category of your 70s and 80s. But quite concerned that how the vaccine's going to be put out to themselves, as well as where they will be going for the vaccine because of them being so clinically vulnerable. And also a lot of these constituents have also not received. if they've not received shielding letters, even though they're clinically vulnerable, you know, are they sure that they're going to be receiving appointments to go forward for these vaccinations, which they really do need, being clinically vulnerable? And also a little bit, not so much worrying, but as a counsellor, a little bit maybe concerned that it's at the race course, because with the clinically vulnerable, they have so many underlying health conditions, which is quite worrying. I myself am clinically vulnerable, very poorly, and it is a bit worrying to think that it's going to be done at a race course, and it's making quite a lot of constituents suffer a little bit with anxiety, etc., and that's quite concerning.
Yeah. Okay, so there's a few bits in there, Councillor Aldred. In terms of making sure that we know that we've got the right people on our list, so to speak. I think part of it goes back to Councillor Waller's question about, is there going to be somewhere that they can call? So if they haven't heard anything, we will hopefully have something that people will be able to ring, but they will be called by their GPs at the point that nationally we're ready to move to that category of patients. Again, it's not it's not a local agreement around where we start with the programme. We're trying to do it as a country, rolling it out to the over 80s and the care home staff and at-risk staff in hospitals, etc. And we will collectively as a country start moving through the risk categories, of which the people you describe will be one. The other thing, though, is that bringing people to the vaccine, so the vaccine that we got at the moment, the Pfizer vaccine, cannot be the vaccine itself cannot be transported from where it can be, where it's delivered to. So therefore, we wouldn't be asking the types of people you're talking about to come into that central site. We would be waiting to see whether or not we can get it to a less risky site. So maybe a GP practice, if it's one of the practices that might be delivering it, that might be deemed less risky. Or if they're extremely vulnerable, then we'll probably be waiting for the next vaccine that's coming on live that you can take into their homes. And so they'd be vaccinated in their homes because we'd want them to stay there. So I think this is, we're in danger of thinking that what we've started this week is going to be the only method of delivery. It isn't. It's going to get much more flexible and much more responsive to people's needs as we go through the next few weeks and months. And I suppose it's kind of, that's back to my point about wait to be called, because if those people you were describing were pitching up at a central site expected to be vaccinated, A, they wouldn't be because they're not on our list, but also B, they're putting themselves at risk by going to somewhere where they're mixing with people. So it's a really strong message, wait to be contacted. It's not that you haven't been thought about, it's just that we haven't got there yet, and we'll get there quite quickly.
Thank you, Caroline.
Okay, thanks.
Thanks very much, Caroline. I've got no more questions. So thanks again, Caroline, for what you've been able to respond to. I appreciate it's quite tricky when it's a national rollout and you're doing just the local bit, and it's the biggest ever national rollout in NHS history.
I think, if I may, I just would like to, I know I've still got colleagues on the line, but this in terms of a full system local NHS response is, I've worked with some fantastic people, and it's the system response that is this, not the hospital or the community nurses, the GPs. This is where you need our NHS to come together, and we've absolutely done that. So that's really positive.
Brilliant. No, thanks, Caroline. Well, hopefully I will be told on Thursday whether the trial vaccine I had, Oxford one, back in August, was the Oxford one, or whether I had the placebo. But that's what I'm supposed to be being told, apparently. Thank you very much. Big apologies to Helen Cliff, who was down on the list as being able to present her petitions, which is all about the St Mary's birthing unit. Now, clearly, the staff that she was going to be aiming to us, the Scrutiny, but also those that have obviously given of their time this morning, nearly 3 hours, have all departed from the meeting. But Helen, if you'd like to, I'm ever so sorry, but if you'd like to, it'll at least be recorded, what you want to say. But I think most of what were in the petitions, which I've seen, actually have been answered by the officers today. But Helen, if you wish to make a statement, please do. I know you're still there.
Oh, hello.
There you go.
Hello. There we go. Sorry, I have to confess I did nip off and get lunch at one point because I thought you had forgotten. But I am back. I'll keep this brief for the benefit of everybody. Absolutely, most of the content of my questions have been addressed. I wouldn't necessarily say answered, but they have been addressed. Just want it to be noted that yes, we have got petitions locally totaling a combination of just under 5,000 signatures. Unfortunately, what you haven't been able to see in your packs is where those signatures have come from. And I just think it's interesting to note that it's not just Melton Mowbray, and the signatures come from Belton and Rutland, Oakham, Uppingham, Leicester, Glenfield, Market Harborough, Sizedon, Loughborough, Lutterworth, Roseley, Mount Sorrel. So this is not just Melton Mowbray shouting about this, and I just want that to be noted. Yep. The other thing I just want, and I'm really disappointed that I didn't get a chance to say this in front of Ian Skidmore and Flo and the relevant clinicians, because one of the things I really want to address is the change of location around the birth centre, and the evidence that the location really is the key here, because we have evidence that actually women aren't being told about the option, or are being told in quite a negative way, and we understand that facts have to be delivered and women have to be made aware of the risk factors. But if I can just share 4 statements very quickly. We get on our campaign Facebook group, we get women frequently tell us that they didn't know the centre existed and was an option for them. This is just taken from this weekend. Charlotte says, when I was pregnant with my first, I told the GP at an appointment I was considering birthing at St Mary's, and he tried to put me off, saying, oh, but it's your first. Surely you'll want to be nice and safe at a hospital rather than there. Marie says, yeah, I was told that you have to book a few days before your due date because there wasn't much room. So wouldn't it be easier to go to the general, which I did. And I had a horrid time there. Heidi says, when I saw my midwife in Quorn, she didn't tell me anything about the option. She just said Royal or General. I found out through word of mouth, and I have to say that's been my personal experience as well. Frances in Rutland, she had heard of St Mary's, but she said, having spoken to a lot of mums and mums to be around Rutland, quite a few weren't sure where I was talking about. A most wonderful place which supports mums' physical and mental well-being. So I would just love those clinicians to be made aware that whatever they think is going on isn't being communicated, and there is a narrative at ground level that is working against the use of this standalone birth centre. And I would just want that to feed into any review process around the success of the one at the general. What is the narrative coming through from clinicians to women on the ground about this as an option, please? And how is that communication happening or not happening successfully? So I think I will leave it there. Everything else is in the pack, and I look forward to receiving questions, answers to the questions that I have fed in.
Yeah, no, thanks very much, Helen. I mean, you appreciate we scrutinise the proposals, but the actual people running it are the CCGs. So everything you feed, particularly petitions, they come to us, we can listen to them and so on, but it's actually the CCGs who will actually be responding directly to any petitions you send to them as part of their review process. Just so you're sure of that. I think part of the point we've had today has been the fact that I think several people have mentioned it. It was very gratifying to actually have a very senior midwife on the call today who was able to respond to a lot of the points that were raised by individual questions and so on, and to members. And I think that, to me, was quite interesting. Never ever had that before. It's been clinicians, as you say, but to actually have a senior nurse being able to respond to some of the questions, I thought was quite interesting. But anyway, thanks very much, Helen. And as I say, the other two papers have had to be postponed on the basis that the people have had to go to other meetings, and most of us, I'm sure, will now want our lunch anyway. The date of our next meeting of this committee is scheduled to take place on Friday the 5th of March at 10 o'clock. However, clearly, as a result of what we've heard today, we may need to arrange an additional meeting to consider the analysis of the consultation. And I would imagine that will probably be sounding like probably late January, maybe early February is my guess. But that's just a guess at this stage. And finally, as this is the last meeting of this committee before the 25th of December, can I wish all members and officers, whoever's on the line, a Merry Christmas. And I hope that we'll have a happy new year once COVID has gone. So thanks very much. Yeah, sure.
Yeah, I've noticed that there obviously were many supplementary questions that were raised at the beginning of the meeting, and I was wondering if it might be possible to, because obviously of the way that was done, it was done in groups, whether or not the individual responses to the supplementary could be pulled out of those the conversations to ensure that every member of the public who asked the supplementary felt they got the response they needed from their supplementary questions. Thank you.
Had a couple of people that have been upset about the fact they didn't get exact answers, but I have to say, as chairman, I think most of the questions were answered.
I agree. I think because it was done in a particular way, which was really helpful, I think some of the members of the public might not have got the answers they need